All right, so thank you for joining. This is Giardini Medicare. We are talking tonight about understanding ancillary coverage. And it's funny, the word ancillary, we just kind of throw it around the office. And really, I finally looked up the textbook definition of ancillary, and it just means supporting. So supporting the primary function of basically other coverages. So that's what we're going to be talking about tonight. This is the first session of our the year in 2026. We're going to have one monthly topic. So we're going to go right into the ancillary coverages for the new year and lots of information in here. So I hope to wrap this up in about 40 minutes and leave you guys all sorts of times for questions. You'll have the replay. If anything gets long, we don't give the slide deck to you all, but we do post this on YouTube. So you've got plenty of times and opportunity to go through the replay if you'd like to do that. Okay. You can put questions in the chat on the right-hand side, and then I can get to those. I will hope to try and answer those if it's an appropriate time, during my talk. Otherwise, we will just save them till the end. And I happen to think the end and the Q&A sometimes is the most valuable of these sessions. So let's get into what ancillary coverage is. I just gave you kind of the textbook definition, but it's just supplemental insurance, okay? And it's designed to fill the gaps of your primary insurance. And just a note, a lot of people tend to think that sometimes this is the first time they've heard of it. They're coming into Medicare and working with us, and then we're talking about ancillary stuff. And you may not have heard that your whole adult life, but these plans work with employer plans, whether you have Obamacare, Christian health shares, which technically isn't insurance, but any kind of situation that you have, it can be appropriate to have these ancillary coverages in pairing up with those plans. What it does, what all of these plans that we're talking about tonight will be doing is covering things like deductibles, co-pays, co-insurance. However, you're going to hear me talk about other costs that they are not insurance related, not deductibles, not co-insurance, things like that, but they could be the non insurance part of an expense. Maybe it's travel, right, to get treatment and things like that. So those are not part of your insurance, but some of these plans will be covering and giving people dollars to kind of help with the cost of those things. The plans pay directly to the consumer. Okay, now you can designate your doctor or a hospital to get the funds from the insurance company, but we never recommend that. Okay, we do recommend that you have the benefits paid directly to you and you get to decide what to do with that money. Okay, so again, you get to decide. It could be a vacation, it could be travel costs. Like I said, it could be a whole bunch of different things. Okay, so these are not also, they're not designed to be in lieu of your insurance. Okay, this is never suggesting don't get an insurance plan, but just get these plans instead. That's not at all what we're talking about. It's just supplementing your primary health insurance coverage wherever you're getting that insurance. Okay, why these coverages matter, and you're hearing us talk about these more and more the last few years. A couple of reasons for that. Number one is life is just getting more expensive with insurance. Co-pays, deductibles, out-of-pocket expenses for the consumer, in my opinion, in the last 2 to 3 years, has pretty well skyrocketed. All right, and then in our particular space of Medicare, we see a lot of illness. Okay, we just do. We see a lot of hospital stays. We see a lot of cancer. We see a lot of reasons to get these plans in addition to your primary insurance coverage. 1 in 5 people age 65 plus are going to be landing in the hospital, and the average stay is 5 days. 70% of people 65 plus receive post-acute care in a skilled nursing facility. We get lots and lots of questions about, well, who's going to pay for this now that I need to go to a facility, or I need maybe help in the home? Who's going to help with those types of things? And we'll talk about that. I'm going to split this into 4 sections, and short-term care will be at the end. The other problem, things that we see, are 1 in 3 people. 1 in 3 women, but 1 in 2 men will be diagnosed with cancer. And unfortunately, we do see a lot of cancer. And then every 40 seconds, someone has a stroke. So you all can attest to this. As you get older, you see people get very ill. You see people pass away. So it's a tough business at times because we see a lot of illness and a lot of sad stuff at times. Okay, so those are just some stats from American Cancer Society, things like that. So again, the ancillary coverages, additional coverages are going to work with any plan that you have. You could have Medicare Advantage. You could have the high deductible G. There's a combination kind of strategy we've been talking more about too. Tonight is not really designed to get into that, but that is a form of Medigap coverage. You might have a plan N, which is Medigap. You might have a plan G. Lots of people, even with the plan G, might add on these plans. Many don't, you don't need to necessarily, but sometimes people are thinking long term. They're thinking, well, I might have that plan G today, but what about in 8 years? Maybe I'm in a Medicare Advantage plan. So if you get the coverages early, you can prepare ahead for that time, which is very, very wise, actually. You might have employer coverage. A lot of times we're talking to people at 65 and we're telling them, like, look, you don't need us now, right? You're going to retire in 3 years, just stay on that employer plan for 3 years. But you might want to consider some of these coverages today to get them ahead of time. All right. So sometimes people are just doing that. And then again, the ACA, there's lots of people out there with $9,000, $10,000, $11,000 max out of pocket. So some of these plans can really come in helpful for those types of things. Again, you just don't need to be Medicare age to get these. My 23-year-old daughter has a cancer plan. Okay. So it's appropriate for everybody. Now, again, I mentioned the high deductible G. Lots of people are asking lots of questions about that. So we do have an entire website dedicated to answering those questions and teaching you more about that. It's a great product for many, many people, as long as you understand it and you just purchase it accordingly, basically. But so go to this website. Again, if we have time, I can answer some of the questions related to the high deductible G combination, but we're just seeing people liking the package. Okay, so the package is basically a high deductible G product along with the cancer, hospital indemnity, heart attack, and stroke. All three of those, or just one or two of those things. Okay, so anyway, you can go there and kind of look around. Okay, so the first segment we're just going to talk about is hospital indemnity plans. So, what are these? These are to protect people essentially when hospitalization happens. Now, it doesn't have to always be hospitalization. It could be you can insure for outpatient surgeries and things like that. But generally, when we're talking about hospital indemnity, we are really talking about the hospital stay. You can build in different things, like I said, but we're looking at two different ways to essentially pay for your large potential deductible, or maybe your nightly stay from an Advantage plan. So you can either do this with a lump sum benefit. So let's say you purchase this with a $1,500 lump sum benefit, so that as soon as you're in the hospital for one night, even a minimum of one night, you're going to get that $1,500 from the insurance company. You don't have to do 1,500. It could be 250, as you can see on the screen here. It could go up to 4,000 with certain companies, but it's per hospital admission. Okay. Even if you're there for 3 days or 10 days or 20 days, you're going to get one lump sum for whatever benefit level you chose. The second option is you can pick a daily benefit. So if you have a Medicare Advantage plan, let's say your plan is going to charge you a $350 copay for every night of being in the hospital for 5 nights, up to 5 nights. And let's say you stay for 7 nights. You're going to get a bill from the insurance company for $350 times 5. So you can, if you wanted to, purchase a hospital indemnity plan that would cover $350 for 5 days. So when you have that charge hit, you make a claim with an insurance company, you get a check, and you go pay your copay to the insurance company. Okay. So it just buffers some of these bigger costs. There's a lot of optional riders you can put on these. You can do ambulance, you can do doctor office visit, outpatient rehab, things like that. We don't generally load these things up. We're really just trying to deal with the bigger cost items like a hospital stay. But some of the plans are actually kind of fun. They include pet boarding, right? Up to 10 days, $50 a day for your pet to be boarded, which, is a big deal when you have to be in the hospital. For some people, that's a really big deal. You can add on different coverages, other riders, a cancer rider, you can a skilled nursing facility rider, things like that. Remember, the more you add, the more costly the product's going to become. But when something happens, it will pay out, obviously, what you're looking to cover. So it's up to you what you're trying to cover there. So a couple things with these plans. Pre-existing conditions. So we want to be sure that people are understanding that you can't buy this coverage right before a planned procedure. So if you have a knee replacement coming up in a couple of months and you've been to the doctor, you have it scheduled, you've been, getting shots in your knees for a couple of years and you're ready to go, the insurance company is going to look back 6 months prior to your starting this plan and that's a pre-existing condition. So any medical advice or treatment you received related to the knee in this case during that time is considered pre-existing. Okay, so the insurance company is not going to cover that. Now, if you had a knee replacement coming up, but then you had a heart attack and landed in the hospital for 3 nights, that will be covered because that was not a pre-existing condition. Okay, so just understand you can't buy these right before getting a surgery or when you're really planning to use it like that. That's not what this is intended for. If people did that, it would be, just buying your homeowner's insurance right after the fire. Okay, so you can't do that. So keep that in mind. So here is just generally the basic story to hospital indemnity. Mike, right? The cost started adding up. He's on an Advantage plan. These are our common customers. They're on a Medicare Advantage plan. He's 71. It's got a low premium, fits his budget. He's generally pretty healthy. He slips on the ice. He goes to the ER. He has to have surgery. He stays in the hospital. Then he has to go to rehab. Okay. Does the Medicare Advantage plan cover those things? The care? Yes. They covered the surgery, covered his hospital stay. Nothing was denied. However, he got a bunch of copays, right? So this is what happens with Medicare Advantage. And again, they're always great when you're healthy, but you end up with the ER copay. You got a daily hospital. Maybe he was in for 2 nights at $350 a night. He's got copays for MRIs, surgery, things like that, and rehab, maybe skilled nursing, cost sharing, things like that, and then follow-up visits. So it all happened in 1 month, and he starts dipping into his savings. All right. So Medicare Advantage plans are certainly going to cover the medical. So we get that question a lot. It's like, what? You mean my plan isn't going to pay for those things? It is going to pay for some things, those things, but it is going to leave you with copays, co-insurance, and things like that, especially if it's a Medicare Advantage plan. Okay. So what happens is he buys a plan, and then the hospital indemnity pays cash directly to Mike during his hospital stay. Money was ready for all those things that he needed it for. Okay. Then Linda, same kind of situation, but this person, we get this question a lot too. It's like, well, I have original Medicare and a Medicare supplement. My supplement is fantastic coverage, and it is. Okay, so Linda is 68, purchases a supplement, a Plan G, everything's perfect. She did everything right. Boom, she has chest pressure, 911 call, 3 nights in the hospital. She recovers. Again, the Medicare supplement absolutely covers her hospital costs, the ambulance ride, everything like that. No financial disaster at all. But again, I talk about the non-medical things, right? Life gets expensive, lost income, her husband took some time off, hospital parking, meals, daily things like that. The dog boarding. I'm bringing that up because it's just kind of a cute little rider they put in there. Plane ticket. She wants her daughter to come stay with her because she's nervous, right? Flies her daughter across the country. And then extra help. She can hire some in-home care if she'd like to do that. So we heard this just from people. It wasn't the bills, the hospital bills that that stress people out. It's kind of those other things that stress people out. I'm exhausted. I can't clean. I can't cook, that kind of stuff. And again, that kind of gets into short-term care, which we'll discuss at the end. But it gives her a safety net. Okay. Again, it's never ever to say that your Medigap is not going to cover those things because it is, but life gets expensive. Lots of people ask us, how do you qualify for these? So I want to give you in each section, I've also including an application. So you can get a sense of what type of questions, because these are all medically underwritten products. Okay. So if you answer yes to some of these questions or to any of these questions on this first page, you will not be able to get the plan. All right. So I just want to give everybody an idea. You can see they're pretty significant. Are you already in a nursing facility? Are you receiving home health care? Are you in a wheelchair? Things like that. Do you have congestive heart failure or internal cancer? So they're looking for significant things. However, when you have this product, again, it goes on to a whole bunch of more questions, right? Don't worry, because we have a broad age group here that one particular company allows anyone between age 60 and 79 to be approved with what we call guarantee issue. All that means is you don't have to answer one of those health questions at all. So it's a broad range. You can see it's almost 20 years, and it encompasses our entire audience, but you can get guarantee issue. That means you're regardless of your health conditions potentially. So if you saw them on the screen, like, something you have and you're thinking, oh my gosh, I can't get that, you can. Now, you still have pre-existing conditions to worry about. So it's still not going to cover things for the first 3 months or 6 months, depending on the insurance company. But guarantee issue is really a great product. Okay. So just remember that. So now we're going to move over to cancer coverage. Now, cancer coverage is pretty popular, actually. It gives you a lump sum cash benefit when you most need it, right? Um, the coverage amount, you can go anywhere from 5,000 to 75,000. We generally just do 10,000. We are not trying to make this a, bonus or profit off of a bad outcome, but 10,000 in our mind is something reasonable in terms of cost. And you can also, maybe you have a Medicare Advantage plan where your max out of pocket is 5,000 and you can pay 2 years of that because generally people with cancer treatments, they're extended. It could be 3 months, it could be 2 years or 5 years. We know some people that have been working, dealing with cancer for 10 years. What's covered? So it's a cancer diagnosis. Carcinoma in situ is covered, which is essentially stage one cancer. Most of these plans are always going to exclude non-melanoma skin cancer, basal cell. Okay. So that's a typical exclusion in these plans. They're so extremely common. Some might do a skin cancer rider like that for basal cell, but it's essentially you want to be looking for carcinoma in situ, which is when the cells are going to be starting. And I'll show you that in a second. You can use the cash for anything. So people always want to know what you can use it for. Experimental. Maybe you want to fly to another state and go get something done, and that's expensive. You can have travel and lodging near those. You can have it for your family. My brother-in-law was diagnosed with melanoma last year and he ultimately succumbed, but it was extremely expensive for his family. He had kids wanting to fly across the country. It was Easter time last year and the tickets were $1,000 per person to get to Arizona. So, you have 8 kids, 8 people that want to come see you. They're all married. It was very, very challenging. Okay. So you can use that for anything you want. Help at home, recovery, wigs, if you lose weight and you need new clothes. I mean, there's so many reasons and unfortunately expenses related to cancer. So 42% of all cancer costs are actually indirect. Okay. So Kristen has a good question. Hospitalized 3 or more times for any reason was one of the questions on the application. Is that accurate? Yes. Yes. So typically they're going to look to see if you've been hospitalized 3 or more times in the past couple of years. You don't count childbirth and things like that, Kristen, but yes, they want to see if there's any kind of um, pattern as to in terms of what you're hospitalized for. So carcinoma in situ, people trying to get to understand what that means. It means stage zero cancer. Cancer cells are present, but they're confined. Okay, they haven't spread, so they're basically zero, stage zero. Okay, some insurance companies will actually exclude. They won't cover stage zero. They start with stage one. So Aetna is the one we use mostly for cancer plans because they'll do in situ, which you do absolutely want that. So here we go, which is storytelling time. Janet's story, cancer disrupting everything. And I'm sure you know people going through this. She's 62. She's done fine. She's still working. Comes the diagnosis. And 62 is not uncommon at all. We meet lots of people coming into Medicare that have either cancer diagnosis history or current cancer diagnosis and working with that. She got a biopsy. She's got cancer. All of a sudden, you know how it is. You're thrown into the whole medical system, appointments, imaging, surgery, treatment, things like that. She had a Medicare Advantage plan. Okay. Covered all the medical bills. 62, you can get a Medicare Advantage plan prior to age 65 on disability, things like that. Money stress. Okay. She hit her max out of pocket, $6,000 that year. $5,000 to $6,000 is the very common max out of pocket for most Advantage plans. So again, if you get a diagnosis in October, and you need chemo radiation, you're going to hit your $5,000 or $6,000 that year. And then January comes pretty quickly. And then boom, you're going to have to go through that again. All right. So very, very common, unfortunately, common stories here. She cuts back at work. Her husband misses work, right? Hotel treatment center. The daughter comes in, very common too. But all those things just kind of pile up. Comments are always, I can handle a copay. I can't handle my whole life getting expensive at one time. Not everybody has $10,000 just sitting there waiting to grab as needed. If you do, then you don't need any of these things, quite honestly. If it's not easy to grab 10 grand, I would consider these plans, but if you have the means to just go and it's not going to hurt you hurt your life, you really then don't need it. Okay. The cancer plans are going to pay out lump sum at the diagnosis. We've done many of these claims. A week later, you have a check in your hands. We help you submit the pathology report. We fax that in and you get the check. So in that case, it's actually very rewarding because we can see it in action and kind of see it helping people. What can you use it for? Like I said, lots of things: travel, lodging, lost income, childcare, whatever you want. Okay. Again, I always want to circle back to this question. Doesn't my Medicare plan cover cancer? Absolutely, it does. However, if you have a Medicare Advantage plan, 20% co-insurance is very, very typical and traditional for chemo and radiation. So yes, it's going to be covered, but a 20% coinsurance on a $12,000 drug every month is going to get you really fast to that max out of pocket. All right. However, if someone has a plan G or a plan N, high deductible, all those Medigap plans, same answer. Of course, it's going to be covered. Um, but people then also want an additional 10,000, even though their plan covers it. You can look at it as paying your premiums for the next couple of years. Okay. And again, remember 42% of all cancer costs are non-medical. So that's super important to always remember. Cancer plan coverage is they're pretty simple. It's essentially the last 5 years. If you had any testing, mammograms, lumps, lost weight, things like that. Are you currently going through any kind of treatment? They're pretty easy to qualify for. And lots of people with history of cancer in their family actually like to buy those plans. Okay, so over to heart attack or stroke coverage. Same kind of theme. You can buy the same amounts from 5,000 to 75,000. Those are the amounts. Again, we just do a 10,000 typically. Not that some people don't want more, but a typical amount we would do is 10,000. Again, what it's going to cover is heart attack and stroke. And 90% of heart attack patients survive when they're hospitalized, and 66% of stroke victims survive past 3 years. So there's a lot that goes into both of those situations. Typically in the beginning, you could be in the hospital for 2 days or 10 days or 6 weeks, strokes especially. The average cost is 21,500 per hospital stay. Again, your medical is going to cover the bulk of that, but you're still going to have co-pays, co-insurance, hospital nights, things like that, and additional, and truly it's the same additional cost, just like it would affect a cancer situation in a family. You're going to have people wanting to visit and hotels and eating out and things like that. Okay. So more stories, right? He survived. Dave survives. He's playing golf one morning. He slurs his words. He got a stroke, right? Quick response. He lives. That's the great news. Then reality shows up. He didn't bounce back very quickly. He has rehab therapy. Couldn't be alone. Wife missed work. Daughter helped out. Things like that. Again, these are just unfortunately very, very typical stories that we have to see every day. He's got therapy, copay, prescriptions, travel back and forth to rehab, home safety, things like that. Your Advantage plans and your Medicare supplement plans and your Medicare itself are not going to cover those things. They're going to cover if you have original Medicare and a supplement. Yes, they'll cover physical therapy, speech therapy, occupational therapy. Prescriptions are going to always be handled out of pocket as normal. Okay, but they're not going to give the safety upgrades. They're not going to, pay for part-time in-home help or your spouse losing income, things like that. All right. So the checks do come in pretty handy. Again, it's a lump sum, and money is all of a sudden is there for everything that he needs: therapy, travel, home upgrades, in-home help, things like that. So again, these are all medical qualifier questions. So they're asking questions about heart attack and stroke. Do you have uncontrolled high blood pressure? If you have high blood pressure medications, as long as it's not uncontrolled, you'll pass medical underwriting. Um, Last 5 years about pacemakers, defibrillators, things like that. Again, it's typically a 5-year look back for most of those types of things. And then, of course, everybody wants to know about the cost. Okay, I think it's going to be more affordable than most people think. Um, Pretty comprehensive protection for every single person, and this is an 65-year-old. So when I'm quoting these, I'm talking about a 65-year-old, and it's roughly $25 a month for $10,000 of cancer, and it's $25 roughly for the indemnity plans. It depends on the state. Michigan could be $15 and other states could be $32. It just depends. There's some cheap states like Virginia, Colorado tend to be pretty cheap on a lot of these products. Heart attack, stroke, same thing. They're roughly all $25. Okay. So that's per month. And again, this is quoting for a 65-year-old. So now we kind of just move to a gap that it affects everybody. All right. So both sides of the aisle in terms of Medicare Advantage is our one big genre of product. And then there's Medicare supplement, right? So there's usually the whole debate of which one is better, et cetera, et cetera. Regardless of what you think is better, what works for you, what doesn't work for you, things like that. The one big gap that everybody has is short-term care coverage. Whether you have an Advantage plan or a supplement, it doesn't matter. So everyone has this gap because Medicare doesn't cover any type of custodial care, short-term care, long-term care. Okay. Even if you have that most expensive, you've got the Plan G, it's the Cadillac, it's fantastic. It's still not going to cover short and long-term care. Okay. So this affects everybody, which is why we kind of talk about it tonight, um, because it is such a big problem. We're seeing an aging population. And we get more and more questions about this stuff all the time. We get questions from the 60-year-old children and the 85-year-old parent, who now falls or needs some custodial care. All of a sudden, they're calling saying, well, how come Medicare isn't covering this? They're just never going to. Okay. They're not going to cover, especially long-term care in a nursing home, assisted living, things like that. The difference between long-term care and short-term care is right here. So long-term care can go on for years, and you can buy insurance to cover long-term care. The duration could be lifetime, and sometimes people can live 10 to 12 years with maybe dementia, something like that. So you can have long-term care, which tends to be a very expensive product and a very challenging product to get people approved for when they turn 65. So again, remember, we're dealing with people coming into Medicare. So by the time we're talking to most people, they are at least 64 plus, and it's too late. For many people, it's too late for traditional long-term care. Um, Traditional, you can have a 90-day elimination period. You can structure it all different ways. Higher premiums, harder to qualify for. We do not offer long-term care. So what we do is we offer short-term care. It's really covering more temporary medical needs. However, it's up to a year. So short-term care is the duration of coverage is up to 1 year. Long-term care is 1 year plus. That's the distinction. Both policies cover you for the same stuff, meaning if you don't satisfy, if you can't perform two of the six ADLs, the activities of daily living, you're on claim for a short or long-term care situation. But again, short-term care is going to cover you up to 1 year in duration. It's going to help you immediately. You have a zero waiting period. It starts immediately. It helps with all sorts of in-home care. It can help with assisted living. You're getting cash to turn around and pay for someone to come into your house to help you. It covers all types of people. I mentioned again, it's not just Medicare people. My neighbor, she broke her arm recently, and for good 12 weeks, she broke the bone between the shoulder and the elbow, and she broke it right there. They did not cast the arm. She was in a sling for up to 12 weeks. Her husband had to do everything. It was her right arm. She couldn't work. She couldn't open the refrigerator. She couldn't pick up a phone. She couldn't drive. She couldn't dress herself. She couldn't bathe. She couldn't do anything. Had she had this, she definitely would have been on claim day one. She could get up to $1,200 a week in her pocket to turn around and pay someone to help her bathe, help her shower, buy her groceries, cook, things like that. Okay. It has far lower premiums, short-term care does, than traditional long-term care, and is much easier to qualify for. Okay. Some people even use it just to fill the gaps between their long-term care policy starting. So they might have purchased long-term care years ago, and they're worried about that first 90 days. To me, that makes sense just because the first 90 days is, to me, sometimes the most critical, right? You've got the first 3 months, like my neighbor, that the first 3 months would have really, really helped. Okay. So long-term care, again, it's just expensive and you're waiting for it to kick in and things like that. Ron says, or commented, I was mentioning the plans may not be logical if you can come up with 10K. Is this true for hospital indemnity? I think it's true for all of them, honestly, Ron. I think if you have money to fund short-term care, and it's not going to impact your world a lot, again, that's not the general population, but sure, you don't need any of these unless, if the 10,000 would really help and you can swing the $25 for sure. But again, if grabbing 10,000 out of a checkbook is pretty easy, then I don't think you really need any of the. So there's no differential between all of them, truly. So here's just a little, example with the long-term care. Jan, we see a lot of single women in this age, this 73 years old. They live alone, they're independent, they don't have a policy, they're healthy, they're pretty healthy, and thinking Medicare is going to cover things. She gets pneumonia. All of a sudden, she's in the hospital. She survives, of course, but she comes home weaker. She's not ready to go to a nursing home. She doesn't need that, but she's just not safe alone, right? She couldn't do the basics, showering without falling, cooking safely, getting to follow-up appointments, remembering her meds. Those are all custodial types of things. So therefore, her daughter takes a week off, things like that. And a lot of people, it does, family becomes a long-term care plan. And we meet lots and lots of people, and especially women, it seems like I don't want my kids to have to do that. They live across the country or they're busy with their kids or things like that. So we have a lot of those types of conversations. Short-term care would have changed things because, again, she would have gotten up to $1,200 cash per week to turn around and purchase care. Okay. And you can hire services, you can hire visiting angels and things like that. Leslie has a good question. How many admissions per year does the hospital indemnity plan cover? Great question. So what happens is if you are out of the hospital for 60 days and you are carefree, they call it, which is basically not in the hospital for 60 days, Leslie, and then you go back on day 66, for example, it's a new admission and then it's a new payment. And that happens repeatedly over your lifetime. So you literally could go into the hospital every 72 days and stay one night and get a check. Karen, if you move states with any of these plans, you take them with you. So everybody takes these coverages with you to the new state. There are a couple states like California. Today, I was dealing with someone with a cancer plan and a heart attack stroke plan. She's 64. In California, you can't even buy these plans at 65 plus. So she was buying it because she's 64. So she can keep it. Once she has it in California, she's a resident there. She keeps it. That's fine. But if you are 69 and buying this plan here in Michigan and you move to California, you still take it with you. So all of these you just take with you. Okay. Coverage. So recovery care again, you can buy all sorts of it's hard to kind of give you a sample quote. I will show you what I purchased because I did purchase one of these, and you can get daily nursing facility up to 400 a day. You can pick 90, 180, 270 days or 360. And the thing is that with these plans too, they also refill one time, meaning if this person buys 360 days of assisted living coverage, $400 a day, they use it all up. Okay. And then for 6 months, they move someplace else out of their assisted living, which this probably wouldn't happen. And then they come back to assisted living, they get a new 360 days. All right. So all of these things that you're seeing, no matter which one you pick, if you pick up to 1,200 a week for your home care rider and you use all 52 weeks, and then you have a 6 month break in coverage and start it again, you get a new 52 weeks. All right. So you can actually get a lot of coverage in these plans. Okay. And over 70% of people will need some sort of care services. Definitely, they do. You can see assisted living facilities are high, expensive. I think we've just got this aging population that we're just not prepared for. We hear all sorts of, again, we just hear so many stories sitting in the middle of this kind of stuff. Even if it turns into palliative care, on its way to hospice care. There's just a real lack of, number one, also quality of care, but also just finding the services. And most of the services are going to cost you $30 to $50 an hour to pay to the home health agency. And so that it's going to add up a lot. Okay. Again, people are always asking like, well, who's going to pay for it? And the answer is the family's going to pay for that. Or they have no assets and they're qualifying for Medicaid. Medicaid is the largest provider of all um, home, short-term care or I'm sorry, nursing home care in the country. Okay. These are the questions you're seeing too that are going to be asked on the questions for short-term care applications. Again, it's not nearly what it is if you're applying for long-term care, but are you already confined? If you're already receiving home health care or you need it, I will tell you, this is when everybody comes because they all of a sudden need it. They do need help with all these things, and then they want to buy coverage for it. You can't do that. You cannot do that. All right. You can't buy it after the fact. There are some plans that I will show you on here, but these are the questions, diabetics, you know, right there. Those are the questions. But if you're looking again at that and concerned you might not qualify for those, there are a couple plans. So there are two plans that will actually cover people with pretty significant illnesses. The only thing you can't be doing is already like in a wheelchair. But if you've got dementia, something like that, people can qualify. Now, I will say that the coverage is not as strong as the first plan that we were looking at, but it is possible. And perhaps for some people, a little bit is better than nothing. But that's going to be pasting, every situation is going to be a little different. This is what I actually did a couple of years ago. The other thing to know with every single thing I'm showing you on here, all four of these types of plans, the younger you buy it, the cheaper it is. So I just tend to purchase the policies as I'm the guinea pig, right? So a couple of years ago, I got this. I'm now going to be almost 61. I pay $77 a month. I have 1,200 a week of home care for 52 weeks. So again, it's 104 weeks for lifetime for me. It does require, this is an Aetna plan in my case, it requires me if I go on claim, my doctor says I can't bathe, I can't dress myself, I can't do a couple things. He says, yes, you need to be on claim. I need to turn around and hire visiting angels for 3 hours this week and pay them $120. And then I get my $1,200. And then at that point, you are on claim with those services with the insurance company. And then every few months, they're going to kind of check in to make sure you're still on claim. It's not super monitored at times, but it's they want to make sure you're still needing the coverage or, the money basically, but I'm getting money. So I'm getting 1,200 a week. I do not have to spend my 1,200 a week on visiting angels. I can do the $120 and I can use the balance for anything I want. The next week, same thing. I can use the money for whatever you want. Okay. I got $400 a day for facility care. Facility care means a nursing home, could mean a skilled nursing facility or assisted living. Some people have used this plan. They have home care. They use up the entire 52 weeks of home care, and then they purchase facility coverage. So then they move to assisted living at that time, and then their coverage will continue. Okay, so you can use, as long as they're two different buckets of benefits, you can use them back to back like that. What you can't do is I can't use, in this case for me, I cannot use my 52 weeks and use it up and then start my next 52 weeks immediately. Okay, I have to have a break of 6 months in between where I'm not using any care, right? And then I could get another 52 weeks started. But I can use 52 weeks up and then I can go into a facility right after that. Okay. You can build in some hospital confinement, things like that. They will have bed reservation. That's for if you leave a facility and then you come back within 10 days. I mean, you can have your bed held, things like that. So there's a couple little benefits like that. You're really buying these plans just for the home care benefit or facility care. We see most people skew towards the home health care because mostly people do want to be at home. They just don't want to bug their daughter or their family. They just want to kind of have a service come in to do things for the most part. Mike, I'm glad you mentioned that. So does the premium go up every year? No, it does not. It is technically, all of these plans are technically able to be increased if the company did a general rate increase for every single consumer that has, in this case, recovery care. It can go up, but since 1996, they've never had a rate increase. The reason these don't go up like traditional long-term care is that when you look at this actuarially, they can really price this very accurately. So in my case, they know that the statistics for a 59-year-old getting 1,200 a week, again, 1,200 a week times 52 weeks or 104 weeks total, they know their total payout. They just know they can really hone in on the exact premiums that need to be charged for these. And that's it. Because after 104 weeks, I'm done. This policy just goes away. So long-term care is different in that if someone buys lifetime benefits, you don't know if someone with dementia will live for 3 years or 13 years. So it's much harder to predict. And you've always heard the stories, how those have gone up and up and up, and the rates and the premiums go up. But in these cases, the younger you buy them, you're locking in your rate. And if anything, we've never seen a rate increase on any of them, any of them. I mean, I'm not cancer, heart attack, stroke, hospital indemnity, none of these. They've always been decreases, if anything. So no, you want to buy it as young as you can. If you have a long-term care policy, should you also have a short-term care policy? Carol, totally up to you, but we've had people with long-term care policies want to insure that first 90 days. So they do 1,200 a week for 90 days, and it's really pretty reasonable. And then you're going to have coverage as soon as you need it, like day one, versus waiting your 90 days. Some long-term care plans even have a 6-month waiting period. So maybe someone wants to do 6 months, you could do 26 weeks of coverage. So there's just nothing that's not customizable in here, and everybody is very different. Some people only want facility coverage, some people only want home health care, some people want, and it can be pretty reasonable. So, you can do 13 weeks if you're 65, 13 weeks of coverage, maybe 750 a week. It just depends on the amounts, but we've seen premiums as low as $25 for this kind of stuff. So at least you have something if something happens. So spend 25 or 30. Most people, I would say, spend 50 to 100. But it really comes down to what you're trying to accomplish and what you want the coverage for. So if you want to learn more about the short-term care, we've built this as well. I want stcshorttermcare.com. It's our dedicated site for all those kinds of resources. You can on there too. You can request a quote. We can send that kind of stuff over to you. But it's an important conversation. And like I said, we've just been the last few years. We've really, really I don't know what it's in the air, but started seeing the real need for all these types of things. And I just think a lot of it is because the cost shifting to the consumer, the aging of the population, you've got a lot of these things coming together. Medicare, the number of people on Medicare by 2030 is just astounding, the growth. And we're starting, I think, just to see to see that. So, the key takeaways: cash is paid to you directly, which is always very nice. It's also tax free. So people ask about the tax implications or tax-free benefits. You get to choose whatever you want to do with this money, whatever you want. Okay. Lock it in while you're younger. So, Mike, that's your question right there. Younger and healthier, those are the keys, really. Get it while you're young and healthy, basically. You have to be healthy to qualify for it. We can tell you all sorts of sob stories too about people that literally sign their application and the next day there's an issue and then they don't qualify. So cancer plans, especially if you have a cancer plan, it will not pay out the first 30 days. So we've had people literally sign their application and within 30 days get a cancer diagnosis, and that's always a bummer. We've got some people that have had a $20,000 cancer plan from years ago, and they told us they call for something and they mentioned they had cancer and they never told us they had cancer. So we got them a check for $20,000. So we get all sorts of crazy stories. Those are great because she was healthy and good, and we just gave her a bonus 20,000 she forgot she had. But you do have to buy these when you're healthy. Okay, you can't wait until you're sick. They're guaranteed renewable, so as long as you keep paying your premium, they're guaranteed to stay. You can take them with them to another state. They will not go up. Again, technically they can. We've just never seen an increase on any of these plans. So we're pretty confident and comfortable saying they're not going to increase. Okay. So if anybody wants to go further and look at any of these coverages, you can schedule with us. We'll email them, whatever you want to do. So let's see. I'm going to flip over to any questions here. So we got through that pretty quickly. Well, 45 minutes. That's what I was hoping for. So does anyone have any questions? And if anybody wants to, I could unmute and you can ask your questions live. I can go back to any slides you might want me to. If you want any questions asked of me, you can email that info@gmedicareteam.com. Address goes to me. Okay. But you can feel free. So I will open it up to questions right now. Ron, I know you had mentioned asking a question. Did you get your question answered? Leslie, my understanding is short-term care policies are not available in Florida. That's true. Unfortunately, that is true. California, Florida, New York, a lot of the East Coast are states, and New Jersey. Those are the big states where the short-term care is not available, which is pretty unfortunate. You can buy plans in other states, and then if you happen to move to one of those places, you can take it with you. But it has something to do with the insurance departments in all those states. It's been challenging for them to try and get those products because we have a lot of people, especially in Florida, that would like to purchase this. But that is true. Any other questions? We're going to start having, I think I mentioned, one topic per month. We've got all of them laid out for the year. I'm going to put the website right here, gmedwebinars.com. So we'll talk one night. I think it's July. We're going to go more into short-term care. We'll go more through that in 45 minutes. We'll do the regular Medicare Advantage, focus on all those different things all throughout the year. We'll talk about the high deductible G. I think the combination one, I think that one might be the next one in February. So there's all ones. Yes, I'll see you. I got you around here. Uh, see if I can find you. Whoops. Ah, okay. Looks like you can unmute now, Ron. Whoops.
Are you able to
Oh,
hear me?
I am. Thank you. Hi, Ron. Can you hear me? Go ahead, Ron. Ron, I'll wait till you can talk. So, Mary, can you give an idea of the same coverages you have for 68-year-old? Yeah, I'm gonna guess about 77, but probably it's probably $100 a month, Mary, but it also depends on your state. If you're Virginia, it's actually pretty cheap in Virginia. I remember talking to a lady in Virginia and she got more coverage than I did, and she's 65 and she's paying less than I am. So it really just depends. But if you email me, I can do it. Michigan, I'm gonna say for that much, um, you're probably, I'm gonna guess 100 without looking it up. Or actually, you know what I can do? Mary, hold on. I will. Ron, if you want to go ahead and ask me, I'm just checking. I can check a little thing on my phone, Mary, give you an exact.
Sure.
I'll just use.
Can you hear me now?
I can hear you.
Oh,
Yes.
that's good. It wasn't working. Thank you. Well,
Oh,
thanks.
sure.
You guys are great. That is for sure.
Good.
Appreciate that.
We try. Thank you.
Yep. And for everybody,
Thanks.
I'm signing up for my Part B starting the 1st of February. So we're working on that with this team. I've been trying to do it for 3 years. I finally decided to retire. I finally decided to retire. This
Right.
January is my 50th anniversary for my career. 50th
Wow.
anniversary. Yep.
That's amazing. You
Time
need
to
to
bail on
retire.
that. Yep. Exactly.
Ye-
So I had the one question about the first things you were talking about the
mhm,
you mentioned that if you can come up with 10K,
mhm,
um, some of the plans probably wouldn't make sense. Is that true for the hospital
mhm.
indemnity also?
I think it's true for all of them because if you take, and it just depends on what kind of Medicare, if you're getting a supplement,
Yep.
and are you looking at the high deductible, G? I don't
Yes,
recall.
possibly. Yes. Mhm.
Okay. So let's say you take the high deductible Jeep. That person is, and then if you go to the hospital for one night, you're going to get a bill for $1,700.
Right.
So if you're okay with that and you've got it to pay elsewhere, right? You can just grab that from a checkbook and it's not going to impact your world. You can't pay
Hmm.
your electric bill, things like that. Then
Hmm.
no. But people like me, like, okay, maybe I could do that, but I'm a believer in insurance, right? So I would leverage the insurance company, but I may or may not. I personally don't have a hospital indemnity plan. I do have cancer. I have two cancer plans, and I've got short-term care.
Hmm. And
So
and do,
it's
do you have the high deductible D?
I'm going to be 61, but that's what I'm planning to get. If
Okay.
nothing changes between now and age 65 for me, because I will go to Medicare at 65, and that would be high deductible G would be my preference.
I mean G. Yeah. Sure. Sure.
That's
So
just me, boys, based on what I see with rate increases and things like that. That's a whole other conversation. But yes.
yeah, for young people, yes. Um,
Hmm.
what about the high? What about the not the regular G? Um,
It's great. It's great, but you just have to realize that the rates they have been going up quite a bit, and they're going to keep going up. So
right.
if
Right.
you're long-term rate sensitive, you want to be careful and just know that the high deductible G with these kind of products can insulate you a lot from rate increases. So that's that kind of combination strategy.
Right. Do you still have in the regular deductible G the 1,700 if you go right into the hospital?
You have it, but the insurance plan itself, the G plan would pay it for you.
I gotcha. Yeah.
That's the difference.
That's the difference between
Yep.
G and high deductible G, right?
You're going to pay everything. You're basically, if you have a high deductible G, you're going to be basically having original Medicare with a $2,950 backstop, max out of pocket. It deductible is a tricky, it's the wrong word for that plan, but it's called high deductible G. It's not you paying the first 29.50. It's the fact that you're gonna have co-pays and things, and once that adds up to 29.50, you're gonna stop paying. Okay.
Right.
So it's a different, they're different. You just have to go with what you're good with, how many policies. Some people don't like having multiple policies. They just don't. So if you want the easy button, you can pay more for it and you don't have to worry about or think about stuff, but just know you can't complain about rates, right? It's like you get those things together, unfortunately or fortunately.
Yes. Very good. Yes.
Good.
Thank you.
Great. Good. You're
Thank you.
welcome.
Everything
You're
is good.
welcome, Ron. Thanks for being here.
Thank you.
Mary, I ran, so the quote for a 68-year-old getting the same exact coverage that I have, Mary, which is a lot, 52 weeks, right? It's $158 a month in Michigan. And that would, so Neela, the next question leads into the plan expires after 104 weeks. So yes, so the plan I have, I got 52 weeks if I use all 104 weeks because I've been able to, let's say, next week something happens to me, I go skiing and I have to use my entire year. I know it's dramatic, but I use 52 weeks of care. Then I'm fine. I finally recover and I'm good for 3 years. And then I fall and something else happens. And then I use another 52 weeks, okay, at that time. So that means ultimately I've used 104 total weeks of care. My policy's done. So, Neela, in that case, my $77 goes away. I don't pay that anymore because I've tapped out all the benefits from my policy. And you don't have to use them consecutively. So it doesn't have to be this massive illness for 52 weeks. It might be that I use 5 weeks of care now, and then 4 weeks next year, and then 8 weeks 2 years from now, things like that. Does that make sense? So it's not consecutive. You're welcome. It's not consecutive having to be in those massive situations. And that's why I bring up my neighbor with the broken arm. Most people think of short-term care as they really think of it as dementia and cancer and just really significant things. But sometimes it's just, my neighbor was trying to clean something she was standing on the table, fell off, and that's what she did. She said, dumbest thing ever. And it really impacted their household. The husband's getting frustrated because he had to do everything. He had to cook, clean, go to Costco. It was pretty challenging over there. So things like that would have just allowed her to hire somebody, or even if you're just paying for Instacart, right, on your grocery bills, things like that, things you normally wouldn't do. It allows you to do some of those things. So I happen to love the short-term care part just because number one, a lot of people don't know about it. A lot of times people will tell us that they go to their financial planner and they say, hey, what about this? And they've never heard of it. I can tell you I've done numerous sessions for financial planners, and I ask every single group, okay, you guys know about long-term care, right? And they're all, yes, yes, yes. Who knows about short-term care? Only one person out of 250 or so this year have answered yes. So they don't even know it exists. And it's a nice product, again, just because people qualify for it. It can be, you can get it down to the price point you want, and some coverage is better than nothing. Would you rather have $800 in cash a week, for 13 weeks, or zero? That's how we kind of look at it. And it's just a really um, needed product in the world of the aging population kind of thing. Any other questions? Good questions. Trying to think of things that we might not have covered. Um, the quotes are easy. They're very easy for us to send right over to you. I can literally, that's how I did it, Mary, on my phone here. I've got a little quoter. A lot of this product is with Aetna. The other product we use a lot of is, it's called Wellaby for the hospital indemnity. Cancer plans, I like Aetna. Mutual of Omaha, different, these are Aflac-like, things like that. Mutual of Omaha has the products. We could do them. We just choose Aetna's very, very solid in this space. So we do probably most with Aetna. And like I said, they've never had an increase since 1996, so that's pretty nice. Bill, are you able to switch back to regular G if you have a high deductible G? It depends. Well, it's always going to be medical underwriting, Bill. So the question is always going to depend on your health. Okay. So if you have a high deductible G and then you got a cancer diagnosis, the answer is going to be no. They're not going to accept you back to a regular G, even with the same insurance company, because they know they're in for covering your costs. So therefore, if somebody had active, like a cancer diagnosis now and they're going through chemo, radiation, and things, I would never recommend a high deductible G. But I talked to someone today that just has a couple things that, they could be deemed significant, needing an MRI twice a year. Even that level of care is not something to scare you away from a high deductible G, because of how the pricing works with Medicare. So again, I think that might be next month. We'll dive more into that. And I do have a replay. If you go to that GMed webinars, we do have a replay of the high deductible G conversation we've just had. And then if you go to that HDG combo site, it gives you more information. The power of the high deductible G is really keeping somebody with a Medicare supplement. So you have the ability to keep um, the positive things of Medicare supplements, which is no networks, no prior authorization, no restrictions, no choosing of your doctors for you, things like that. Those are the really big perks for Medicare supplements. And you don't lose that because the high deductible G is still a Medicare supplement. But what you do lose, which is the good thing to lose of the supplements, is the massive rate increases that we're seeing. We just saw Humana's taking a 29% increase, and Aetna's taking a big increase. I was looking at Texas the other day is 18%. And then if you look at the high deductible Gs, they're going up pretty much 0 or 2% or 3%. So so that's the only way to be able to send. We meet lots of people too that maybe their budget is just, it's close. They really want that plan G, but you just don't know if you can have it and maintain it for 10 years. And so if you kind of think you can't in 10 years, do you want to be pushed later into a Medicare Advantage plan to save money? Or do you want to just go with the high deductible G and then buy a couple of the products to buffer the cost? Because if you take a high deductible G and you get a cancer diagnosis, boom, at least we can give you the $10,000 to cover your deductible for 2, 3 years. So, and you've got the freedom and you've got all the perks of Medicare supplement. Approximately how much does short-term care coverage in Ohio? Neela, can you give me an Ohio zip code? I know Michigan ones, I don't really know. Ohio ones, I know it's 44 something, I think. 45. Okay, so let me go back. I can tell you in a minute. It's not going to vary that much. So what I can do is let's say, so this is where you just start playing with things. You go 45322 and you go 68 years old, female. It doesn't matter smoker, non-smoker. And we just go to recovery care. So then I would just say, okay, let's look at $200 a day. Instead of what I did, you to pick 200 a day for 90 days. And let's just say your home care, you'd want $1,200 for only 26 weeks, right? To keep some costs down. So 26 weeks. So if we do that, you're looking at $91 in that case. And then you just keep ratcheting down. So it's like, well, okay, 1,200, that's pretty steep. What's 900 a week for 26 weeks? And we hit quote, drops to $79. So you can see you can just kind of massage it to what you want to try and get it to if that helps. Don, you mentioned that there's no short-term care insurance policies in Florida, right? Is there a substitute or similar? There's not really a substitute. The only thing people do get to is there's annuities you can get that can do some of this. You can look at there's hybrid solutions. Your financial planner might recommend some of those. Sometimes you can basically transferring assets. Some people take 50,000 and put it into certain products that can, maybe turn that 50,000 into 100,000 in long-term care. And if you never use it, it becomes a death benefit to your kids, things like that. So there's a couple things. We don't really work in those arenas. We just do the classic short-term care. And yeah, it's just a bummer that Florida isn't covered. There's a ton of people, and it would be more expensive in Florida because of the age population and things like that. Vicky, hi Vicky. Does regular more expensive straight plan G? With that, are you able to choose any doctor? Do you need referrals first or no? You don't need any referrals, and you choose any doctor that takes a Medicare. So whether you choose an N, a regular G, Vicky, or a high deductible G, any of those products, that's all considered Medicare supplement. And that's because you have original Medicare plus the supplement. You go to any doctor that takes Medicare in the entire country and never need a referral. Correct. Neil, you're welcome. Bill, I have regular G now. Do I have to wait until open enrollment to switch to high deductible G? No, you would do it right now. You literally could do it for February 1st. And as long as the high deductible G, it's not available to with all companies in all states. Like Bill, if you're in Michigan, like United Healthcare does not have a high deductible G here. We do mostly Bankers Fidelity and Mutual of Omaha for the high deductible Gs in Michigan right now. And you do not have to switch. If anybody wants to change ever Medicare supplements during the calendar year, you just change. You do not have to wait to the open enrollment. The open enrollment is really just for your drug plans, Bill. So do it now while you can, for sure. Yep, you're welcome. Do it while you can, while you're healthy. That's the whole message with all of this stuff is you have to do it when you're healthy enough to qualify. Younger, the better, things like that. You are welcome. Good questions, y'all. Any other questions? What are some good numbers, days, dollars for facility care and home care? Um, it's a lot of it's based on budget, Michael. It just depends on what people want, and then what are you trying to plan for, more assisted living types of things or home care? Because you can really ratchet down the facility care. You can do $10 a day only because that's the minimum you have to have on the policy and concentrate only on the home care. So it just depends. We just usually start with the budget and get people comfortable with what they want. Vicky, thank you. Thanks for being here. You're welcome, Mary. I don't know if that helps, Michael. Um, it's just trying to massage your way into what's a good, you know, um, the more is better, of course, if it's needed. 70% of people do need this kind of stuff at some point in their life. So I think it's a pretty good shot that you're going to use some. Are you going to use it all? No, maybe not. Some people argued, like, well, what if I have a heart attack in my chair? It's like, well, then you never used it, and that's what happens. It's impossible to predict. Jim, hopefully it helps. Thanks. Thanks. You're welcome, Mary. I wish Aetna, if there's one thing I wish is Aetna would have a really good consumer link. We've tried for years to get them to create something. The one they have is terrible. It's very confusing. You can't get to the pro. It's hard to manipulate. It's bad. So I wish they would have just something very simple on our short-term care, Michael. That I want STC website. I can back up to where that is. We do have some calculators. They're not exactly perfect, but if you want to go there, there are some calculators that you guys can actually play around with this, put your zip code in. We've kind of fed it the information from the carrier, so we hope it's pretty close to true, but at least it'll give you directionally some information right there to kind of do it your own for quoting. So that might help you too there. And then you can look at different options and all sorts of things. And like I said, I think it's July's session. We'll dive way more into short-term care because it's a huge conversation. Leslie, thank you. You just kind of live in it and you just kind of learn stuff. I don't know. After a decade, I think it all just kind of sinks in here. So thanks for that. Appreciate it. Yeah, and if there's anything, question-wise or just webinar suggestions, they tend to be helpful, so I don't mind jumping on here once a month, but we just need topics. Thank you, Bill. Thanks for the info and for your time. You're welcome. You're welcome. It's fun to help get the information out there. But if you have, requests for topics, of course, always relay those to us too. All right. If there's no more questions, I will let us wrap it up. You guys can get on to your evening. We'll keep it at about an hour. That's not too bad at all. And the recording will be here for whoever wants that. And feel free to share that with anybody who needs the recording as well. All right. Good night, everybody.
Very good. Thank you.
Thanks, Ron.
Bye now.
Bye bye.